Yeah, Etta, thank you. It's very early in the morning for you. Thank you for getting up. Can you tell us whereabouts you are in this whole wide world, Etta?
I am in, excuse me, I have like a little cold coming on,
Mm.
a nice virus. Uh, I'm in Rochester, New York. It's
Uh-huh.
part of the Finger Lakes region, just east of Buffalo. But I spent about 30 years down in Westchester County, so I'm very familiar with the whole state of New York, uh, both geographically and medically as well.
Okay. All right. So you live in New York. And what's your job?
I'm a palliative care physician. I've been doing that for about 6 years now, and before that, I was specializing in internal medicine. I've been a hospitalist, and I also had my own practice. So I've done a
Okay.
lot of different things.
Cool. Fantastic. And did you spend some time abroad as well? Where you got links with Malawi?
Yeah, I've done some volunteer work in Malawi
Right.
um, with an organization that's based in San Francisco. Um, I can talk about it if you want, but it's
Yeah.
called Global AIDS Interfaith Alliance,
Okay.
and it was started by an Episcopal priest and a neurosurgeon at UCSF, which is a very interesting combination. And I've been working with them for about 16 years already.
I would love
Uh,
to talk about that, but
yeah,
I've got an interest in Malawi. But can you tell us first of all about the situation in New York, just for daily life? You know, when you walk out on the
yeah.
streets and in the shops and things like that.
So I'm looking out my big picture window, and there's absolutely nothing happening out here. There's very few people out on the streets, certainly in the early part of the day. There's more and more traffic now, but just there's just this feel of people just staying down, hibernating, and not moving around very much. That's different than, of course, what the media is sometimes portraying. Of course, there's a small group of people who feel like they can walk out and not use the social distancing and the masks. But I have a feeling that that's a really small minority at the moment, and you just get a lot of that on the news.
Mm. So most of
The
the
most,
population realise that this is an important thing and that they are complying with the social distancing, the
yes,
mask wearing, and the hygiene requirements.
yes,
Yeah.
exactly. Yep. I think when they look at the polls, it's 70-80% want to continue some of the measures that we're using now to continue to keep the virus from spreading.
Mm. Yeah, I
Yep.
get the impression the situation in the United States is very disparate. Some states are doing a lot of things, and other states aren't doing so much. And but New York
Yeah.
seems to be quite a proactive area, from what you're saying.
As we had to be.
Indeed.
And we did have the proper leadership, I believe, in that area. We did, you know, our Governor Cuomo has been on every day. I started listening to him about the end of March, and it's been pretty fantastic what he's been not only doing, but also the way he conveys it
Yeah.
is, this is so important that we not overwhelm our healthcare system because our healthcare system is a bit on the fragile side, and so it was super important that we not completely sink us with this pandemic.
Yeah. Absolutely. Yeah. So have you been involved in COVID patients professionally at all, or have you been
Yes,
staying true to
very
the field?
much. Yes, because my hospital it's set in the urban area of Rochester, but we are surrounded by a lot of rural counties. So we're sort of in a mixed area in terms of the economics, if you will, and where people live. So our hospital, because we're one of the busiest emergency rooms in the country, which shocks me every time I hear that,
Mm, mm,
we became a COVID designated hospital, and
mm.
so the patients coming in from the rural areas were all sent to our hospital. Now, there's another hospital in Rochester, which is very famous, Strong Hospital, and they also have a lot of COVID patients as well. So probably the most we had at any time was about 30 to 40 patients. And I'm on the palliative care team. So our team, which is a very small team, we were taking care of about half of those.
Wow. Mm.
Yeah.
What do you think the typical incubation period is for this disease, Etta? Do you think?
I'm listening to the experts, probably 5 to 10 days before you start
Yeah,
having
it's kind
symptoms.
of the average. Yeah.
Yeah.
And what often is the first symptoms from the patients you've been looking after? What's the first thing that they think? "Oh, just a minute, I don't feel quite right today." What's normally the first thing?
So I'm not seeing patients usually at the beginning of their
Mm,
illness.
mm, mm.
I get called when things are pretty desperate and they
Okay.
want us to have a conversation and more with the family usually when the patients are intubated. Um, but having said that, I think I had the illness back in March, as well as two of my team members were recently diagnosed with COVID. And one of them, our nurse practitioner, she was having back pain. And she started with a cough as well, but her main focus was on her back. And she asked me to see if she had zoster and things like that. And a day later, she tested positive for the virus. And
Right,
she's been out for 2 weeks already at home.
right.
So she's pretty affected by it. And then she shared a room with our chaplain, and 5 days later, he would tested positive, and he just had malaise and didn't feel well. But he's already back at work.
What age?
So
What age is he at?
I'm guessing mid 50s. I don't know actually.
And what ethnicity is he, if you don't mind?
Both of them are white.
Yeah,
Yeah,
yeah. Interesting.
we've
Yeah.
had a lot of white patients. I know that when you break down the racial divides, Cuomo went over this for New York State recently. Yes, there are a lot of Black and Hispanic patients affected, but again, I'm thinking more instead of a racial bias, it's more the social structure of how people live. So we were in close contact with HIV, COVID patients, and that's how we got infected. But when you're out in the communities, I think it's spreading in more close contact, poorer uh, neighborhoods where it's harder to maintain the social distancing or harder to get masks or whatever it is that you need to stay safe.
How are you feeling now, Etta? I do hope you're back to.
Oh, I'm fine. This was more than a month ago. I did track my fever and things like that when I was not feeling well. I never had a fever that would be considered a true fever. My basal temperature in Fahrenheit is about 96.5. Um,
So that's
but
that's lowish. You have a normal lowish body temperature.
yeah,
Yeah.
and I just tracked how I felt. There was one day when I did feel shortness of breath because
What
I
what,
would
what
go
was the
out and
what was
walk.
the if you don't mind, what was the first thing you noticed?
The very first thing was just feeling completely run down, malaise, muscle aches, and a little bit of a cough.
Muscle aches all over,
Yeah, more like a flu,
and a
like
productive cough, or was it a dry cough?
dry cough.
Yeah. So just done well with a cough, and then did you
Yep.
develop a fever?
The highest I got was 98.9. I don't know if anyone would ever call that a fever.
Yeah,
It was
that's
just
nice.
high for me.
It's about 37.2 or something.
Yeah,
It's
it's
virtually
almost normal.
it's within a normal range one, but I think it's
Right.
high for you, isn't it? Because as you say, you're normally quite.
Yeah. Now that I've been checking, not only did I check then, but now since my nurse practitioner got sick, we've been all mandated to check our temperature twice a day. So it continues to be 96, 97.
Right. Where was this back pain in your nurse practitioner? Was it like all over her back, or was it
No, it
superficial?
was
Or
only on the right side. That's why she thought she might have zoster.
yeah.
But there was no rash.
So was it a superficial pain, or was it like a deep?
It was more musculoskeletal. Yeah, like
Okay.
myalgia, I guess you'd call it.
Yeah, and just on one
Yep.
side. Strange, isn't it?
Yep.
Yeah. Okay. Right. Yeah.
Um,
So
and
what?
her,
Sorry. Go
I
ahead.
was going to say, her features are still extreme fatigue, and never really had much of a fever.
And that's how long ago?
2 weeks now.
So she's been
2 weeks
very, very
today.
tired for 2 weeks.
Yep.
Right. Okay. Yeah. How were you tested then, Etta? Did you have an antigen test?
Yes, PCR.
Yeah. Yeah.
Um,
Yeah.
this was back about the third week of March, and we had just gotten an email. We got emails every day from the hospital, and it said, hospital workers with symptoms are allowed to be tested. So I said, well, I have symptoms. And I tried to go to we had tents erected on the grounds of the
Yeah.
hospital. And I
Yeah.
tried to go there, and they said, no, you don't have a fever, go home. And then the doctor in the tent had looked at my paperwork and said, she needs to come back for a test. So I went back and they tested me. But I tested negative. And I have a feeling the test wasn't done properly because my second test was done properly. And that was also negative when my nurse practitioner was sick. So I'm thinking it's possible I'm immune because we were exposed to the same patients.
Yes. My personal belief is that you will be immune, but it would be lovely to confirm that with antibody testing
Right.
and some more empirical data, wouldn't it? So,
Yep.
and I
It'd
know
be
you can't
nice.
go into individual patients in any way, Etta, but the patients that you do see, what sort of complications are they suffering from generally?
Most of them have been with respiratory symptoms. They tend to be older, although we've taken care of people in their 50s. I think one or two in their 40s. Some of them have been on the ventilator for 2 to 4 weeks. We do have several miraculous recoveries, which has been great.
Really?
Um,
Because if you've been on a ventilator for that length of time, I would be very pessimistic.
we were, yeah. We've had very stoic pulmonary attendings jumping up and down when they hear their patients talk for the first time
Yeah, yeah, yeah,
after 4 weeks of
yeah,
being ventilated.
yeah.
Yeah, it's
Yeah, it's
been
those
pretty.
moments that make it all worthwhile, isn't it? It's
Yep.
quite
Yeah.
amazing. So mostly respiratory complications. Are you seeing much kidney problems, acute kidney injury?
Yeah, I have one guy who does have acute kidney injury right now, and the nephrologist thinks it could be from COVID. I don't have much experience with how that should look, so he is about to start dialysis. That was a big, tough discussion I had with his family,
Yeah,
whether or not to proceed, because he already has heart failure. So
yeah,
it could be related to that too.
sure,
It could be multifactorial, as we say.
sure, sure, yeah. Right. But you are seeing quite a few deaths. It must be quite difficult on an emotional level.
I think the hardest thing is we're not usually with them when they die. They die alone.
Yeah,
And that's the hard part.
yeah, yeah.
It's-
Wouldn't it be great to know if you're immune though? I mean, do you suspect? Do you suspect you're immune? You believe you're immune?
Well, really, because my nurse practitioner and I, we were both exposed to a very high risk patient. We didn't have the N95 mask at that time, but we wanted to go in the room anyhow. We put triple masks on, I remember,
Wow.
because his brother wanted to talk to him, and we knew this patient was going to die.
Yeah.
And so we did that anyhow. And he was on high flow, which is an extremely high risk condition. And
So you'd be aerosolizing the.
continuously,
Yeah,
yeah.
yeah, yeah,
And we were both in there, and I'm fine, and she got quite ill. So
yeah.
it's all guesswork at this point,
And
but
have you any idea why some people get asymptomatic disease? Some people get a bit ill, and some people die. I mean, it's
well, I think some of it is what you've been talking about is the immune system. That's part of it. If you have a very good intact immune system, maybe you just fight it off easier. I think it's the viral load. I think going into a high flow room
so
was a
you, so,
very
so
high
you think
risk.
if you get a lot of you get infected with a lot of viral particles all at the same time, that's
Yeah.
going to give you a more severe disease evolution.
Yep. I think so. Yeah.
Because that's interesting, and it does certainly seem to be the case, and yet it doesn't seem quite consistent with what the infectious disease doctors were talking about, say this time last year, where it doesn't seem most diseases don't seem to be related to viral load. So is this unusual, do you think, for COVID, where viral load is such a big factor?
That I don't know. Um, I wouldn't be able to speak to that directly. It's anecdotal evidence. Just looking at what happened with the nurse practitioner and the chaplain, they were practicing social distancing, but in the same enclosed space,
Yes.
but probably a very minimal exposure for him. I don't know.
I agree with you. It certainly all seems to fit, doesn't it? It seems to add up. But it's just a rather unusual addition to our knowledge of the way infectious diseases spread. It's
Yeah, well, you have a lot to learn.
I certainly do. Yeah. Do you think this is going to be more severe if you have a patient who has COVID-19 who perhaps catches influenza at the same time?
I would think so. Honestly, I haven't seen that. You would have thought with flu being pretty bad earlier in the year that we would see that. But I think the social distancing measures people took to heart and the flu kind of stopped tracking around. I've seen
Yeah.
very little flu at all since early March. And so I would think they might be sicker, but the COVID is pretty bad. So that's going to probably take over in terms of seriousness.
Yeah.
That's
Yeah,
what we've seen.
I heard some interesting data out of India that normal waterborne diseases are down by about 90%
Yeah.
because the same hygiene and isolation protocols reduce all of these infectious diseases, not just the COVID, which is excellent. Yeah.
Yeah.
How hopeful are you for a vaccine, Etta, do you think?
Oh, it'll come. I'm just not sure. I'm worried that we're going to rush it, of course. But right now, they're actually recruiting people in Rochester. We're one of 4 sites to
Yeah.
test a particular vaccine, which it makes me a little nervous because they're picking people with very strict criteria that have no comorbid illness, including hypertension.
Mm.
So I'm worried that this is like some type of attenuated virus, and I'm not sure. I don't really know much about it. So I just was surprised when I heard how strict the criteria were.
Yeah. Yeah.
Seeing anybody that has any of the conditions associated with a bad outcome. I mean,
It's almost as if they're looking for the right outcome, doesn't it? You know, rather than picking a representative sample.
well, it always makes me worry. Are they picking people who might develop the illness accidentally? See what I mean?
Yeah.
Uh,
Yeah.
Maybe
Yeah.
you can leave that part off, but it just worries me a little bit.
Yeah.
Certainly, I don't qualify.
No,
Get it?
I think it's right. We are thinking aloud. There's many things we don't know, and
Yeah.
you know,
So,
you're in the heart of this, and we still don't pretend to understand a lot of what's going on.
well, for example, I think that we have the ability at the hospital to test, at last I heard, 250 tests a day, PCR, antigen tests. Um, and yet we're not testing new patients as they come in. I saw a new patient yesterday whose chief complaint was falling. And that actually is one of the things that we see associated with the illness is people with weakness, right? With older
Right.
people. And
Muscular
so
weakness, or do you think it's neurological?
it could be either one. And again, she has another reason for it. However, why aren't we testing her when she comes in, just to be sure?
Sure.
I mean, we're all wearing the usual masks, but it just seems to me a safety issue at this point because the biggest areas of spread right now are in the home. Actually, Mr. Cuomo said that yesterday on his talk that they looked at where the new infections are coming from, and by and large, it's a home, 60%.
Right.
So we need to be checking patients as they come into the hospital, and we're not completely doing that yet.
Mm.
I don't know why.
So the poorly people you have been looking after and the patients that have died, sadly, have they got the sort of classic comorbidities that we would expect, the heart disease, the hypertension?
Yeah, the one that was on high flow, he didn't want to be intubated, and he had pretty serious systolic heart failure, congestive heart
Right,
failure.
right,
Yeah.
yeah. You know these ACE2 receptors that the
Yes.
virus absorbs onto. Do you know anything about those at all? I mean, I can't even
So,
work out why you've got ACE2 receptors in your lungs. I can understand why it's in the blood vessels,
and it's in
but
the gut as well.
yeah, yeah.
I think
Tell us
I'm a
anything
cell
you know.
biologist.
Sorry?
I'm actually trained as a cell biologist, and
Right.
I love listening to those talks online about the ACE2 receptors, and I had a big debate in my own mind about whether to continue on losartan, which I'm on. So I eventually decided to stay on it. I said, "Well, I'm still here. I might as well keep
Mm,
taking it."
yeah.
Uh,
That's a blocker, isn't it?
ACE receptor
ACE
blocker,
receptor
yeah.
blocker. Yeah, yeah, yeah. Right.
And I kept thinking in my simplicity brain was that should help, if it blocks the same
Yeah.
site. But anyhow, I think that it's a fascinating topic. I need to spend more time with it because cell biology is very complicated. But I think that's part of the reason we're getting some of the vast constellation of symptoms that we are, with the GI symptoms as well.
Yeah.
So, and that's what I was going to say about the disease. I think there are people who maybe it attacks an area of the body that isn't going to lead to hospitalization, or just is going to end up with a mild cluster of symptoms like I had, and you don't need the hospital.
Yeah, fascinating. Yeah. How do you see things playing out in New York over the next sort of months, I guess?
I wish I knew. I People are doing their best to stick with the distancing. We're going to probably try to open up small businesses that are safer. That's the new catchword. Instead of essential, are you safe? And for example, I do go to a barn, and what we're hoping is that we can only have 2 people in the barn at the time, and things like that. Wear masks, and that should make it safe. Restaurants are going to be a huge problem. The gardening center near me just opened up, and they actually marked off 6 feet distances all along the floor. And they are letting 20 people in the gardening center at a time, so they're counting.
Yeah, it's questionable whether it's going to be economically viable, isn't it? But
right.
I guess life isn't going to be back to normal till we have herd immunity through either everyone catching this or through vaccination.
And everyone catching this will kill the healthcare system. I still think we have to be vigilant about that. Cuomo was very vigilant. Despite the millions of people in New York City, it's sort of astonishing what he was able to accomplish.
Yes. I mean, I've heard figures that there was a study of antibodies on 3,000 people in New York State, and the estimated 15 to 20% of people may have already been infected. Do you think that's kind of reasonable, or?
Yeah, I do, because actually when you break it down, that was 20% in the 5 boroughs of New York City. And then the surrounding boroughs were about maybe 15%. And then when you come upstate, very interesting, Buffalo, just west of me, was about 7, 8%, which was quite high for a more distant city. And Rochester, where I am, was about 3 or 4%. So
those ratios kind of make sense, don't they?
Yeah, they do.
Yeah. So what sort of infection rate do you think we would need to have proper herd immunity?
Well, again, not being an infectious disease expert, I'm guessing around 80%.
Yeah, that was roughly what I'm thinking. Yeah. Yeah.
So with hopefully the same as the flu. If we get more people to get the flu vaccine, you've got the herd immunity, and that works out better.
Yeah. Just going back to your own field, Etta, have you found patients have any pain in this illness?
The musculoskeletal pain, yeah.
Musculoskeletal pain. Can that be quite severe?
It was for this particular nurse practitioner. I think she was frightened by it.
Yeah, right. Did she try any analgesic?
Well, because we've all been told not to take ibuprofen, which may be completely ridiculous. We only are taking Tylenol, paracetamol here, and that's about it.
Right. I mean, she didn't try any opiates.
Oh no. We prescribe them. We don't take them. No, she didn't.
I mean, in A&E, we give out opium, morphine, really quite readily. It's not.
Yeah.
10 milligrams of Oromorph is absolutely routine. It's.
Oh yeah.
Yeah. So let me ask you a bit of a nasty question. Do you
Sure.
think that reducing the temperature with acetaminophen, paracetamol, ibuprofen reduces the efficiency of the immune system?
Oh yeah, and in fact, again, using my poor nurse practitioner as an example, her son caught it from her. He's in his mid-20s, I guess, and she said his temperature, again, Fahrenheit, 103 degrees.
That's high.
Yeah, it's pretty high. And I said, look, unless he's must take it, avoid taking the Tylenol, because that high temperature should be killing the virus.
Absolutely,
that's what it's for. Yeah.
I'm delighted we agree on that. That's
Oh yeah.
it's
I'm
surprising how many doctors just say take paracetamol without almost, just
yeah.
as if the fever's the problem.
Yeah.
The fever's not the problem. It's the symptom.
I'm also trained in evidence-based medicine, so I try to base my choices on what I can see from the evidence, as you do, and why I like your show. I've also been on vitamin D
Yeah.
for years.
Oh,
So
good.
again, maybe that helped me when I got sick. I have no idea,
Do
but
you
I was
get
all
do you get
thinking
much
that.
sun in summertime, Etta?
I don't. I'm not a sun worshiper.
Right.
Never have been. I like
Yeah.
to be active,
Yeah.
but I put sunblock on and wear hats and things like that. So, I'm not getting sunburned ever.
Sure.
So,
How much do
yeah.
you take?
That's a really good question. I think it's a 5,000 international units in one tablet, so I take one a
Oh, that's
day.
quite a lot because
So it seems like enough.
I'm taking 50
Ooh,
micrograms,
I
which
think
is
we lost you for 1 second.
sorry, I'm taking 50 micrograms of vitamin
Yeah.
D, which is
Yep.
2,000 units.
Yep.
So you're taking 5,000, which is well, I can't work it out. 125 micrograms or something. So it's fairly high dose.
Yeah.
Yeah.
Yeah, I probably skip a day or two here and
Yeah,
there.
sure. When it's fat soluble, you can do that. That's
Yeah.
fine. It's fairly high dose. And I think this is a factor in darker skinned people having more severe disease. I mean, is that reasonable, do you think?
It may be. I've been thinking a lot about what you say because, of course, I am worried about sub-Saharan Africa. Um, and then the alternative for them, talking to the head of my organization, is they're outside pretty much all the time in, as you would say, fresh air. So there are some factors about their lifestyle that may mitigate the illness all by itself. We can only hang on to those things and try to do the best we can.
And in the tropical sun, the dark skin will make enough vitamin D, of course, but
Yeah.
in the sun in Chicago, I don't think it will. So
Right,
it's
right, exactly.
yeah, yeah.
And that, yeah, as you point out, it might certainly there's no harm
I
in
don't
giving
think
someone
so. No,
vitamin D.
no, no,
So
no. I suspect it's a pandemic, quite honestly, of vitamin D deficiency, and
yeah,
yeah, yeah,
we're all indoors on our computers and our smartphones, so we don't go outside.
absolutely, yeah, yeah, yeah. So how are you bearing up, physically and emotionally with your work at the moment, Etta? Is it difficult or
Um,
tiring? Must obviously exhausting.
I think I mentioned that I was a resident during HIV pandemic in the Bronx, which was probably the hardest thing I'd ever done and
Wow.
ever will do.
Mm.
Um, and at being a resident at the same time, working 36 hours.
And that's
So
before the antiretroviral therapies.
exactly
Mm.
1 year before, and it
Mm.
was like switching a light.
Yeah,
All
yeah.
of a sudden it cleared up. Um,
Yeah, a lot of people were dying then, weren't they?
oh my gosh, and young people.
Mm.
All at that time
Terrible.
they were
Yeah,
20s, 30s. It was
yeah,
really terrible.
yeah.
Babies.
Oh,
So um,
yeah.
yeah, this is really hard, and I think it's probably more affecting more people worldwide, and that makes it very difficult. But for me personally,
Mm.
I seem to be bearing up okay. I try to be calm and deal with the things I can take care of and let everything else go. And our team has been pretty amazing, bearing up under all this and just spreading out and doing as much as we possibly can. I do exercise. I started painting. I'm doing things to get me through it.
I'm sure your calm leadership is a massive asset to the team as well, Etta. Yeah,
Yeah.
yeah. Etta, thank you very much for that. That was absolutely fascinating.
Yep.
I'm just hoping everything's recorded.
I hope so too.
So I'm going to
Let
cut
me
it
know if
there. Yeah,
it's not.
yeah,
I'm certainly happy to try again,
yeah.
but
No, that's great, Etta. Thanks. Let me just try and stop that and see if it's worked. It should say stop
okay.
recording.